We've already seen that virtual care is providing care to a lot of different patient groups, whether it's patients that are really critically ill in an emergency department in an acute hospital bed, or in their home, people with mental health illnesses, people with a chronic condition, young kids that require specialist attention, or a pregnant mum. We know that right across the lifespan and right across all of the diseases and health issues that people have, there's opportunities for new cutting-edge technology to make a real impact in their lives.
In a place like remote Australia where we work in, where there are a lot of challenges for easy access to healthcare and services, these virtual technologies has helped close the gap in terms of getting the patient's needs and cares met at the doorstep, avoiding unwarranted hospital admissions.
We visit them in the home, we demonstrate the process, we have the tablet like this, and we also have the devices which we monitor them with, which are blood pressure machines with the saturation probes. Then we feed it back to the GP, the results.
It gives you a really good snapshot of how the patient's vital parameters are, which includes his blood pressure, patient's heart rate, patient's oxygen saturation and blood sugars.
The patients really feel reassured to know that someone else is at the other end of this information, that it's been monitored, and if there's a need, that something's been acted on.
Patients are finding this process very simple. We can video call them, they can ring us at any time, they have any concerns, it's very simple.
This method of care has helped patients to be at home and be managed at home.
We've given Jordan support through a bit of a rough time that she's had with her mental health, and we've been able to provide that in her home.
I found it very helpful. It was more comfortable for me to be at my own home. They helped me with my meds and helped me look into stuff for moving forward.
So it's really important from a community perspective for the patients to actually stay closer to home, to feel connected to their families, to feel connected to country. Virtual support actually allows us to keep perhaps more complex cases local. It allows us to keep people within their community and receive that level of community and family support.
I think it really worked for Jordan, and it has been working for a lot of our hospital and home patients to be in their own home and having that autonomy and choice and still being able to have those community connections that are really important.
They feel a lot more well supported, they feel less anxious about travelling to larger sites and away from home.
Our absolute dream and vision is to help people be healthier and for our communities to thrive. Our network of health services is something that can help that to happen. With the cutting-edge technology and the new ways of working, this is our time to make a real impact, to connect people to something they can feel confident in and to make an impact in their lives.